Children's hospitals across the country are overwhelmed as respiratory illnesses spread quickly. Children under 2 years old and older high-risk kids are catching a viral infection called RSV. Experts say the cooler weather and less mask wearing are partly to blame for the surge. Angelique Arentalk found out Hampton Roads is not exempt.
Parents across the country,
I thought it was just like a normal cold at first.
And here in Virginia,
it's very scary.
are seeing respiratory syncytial virus, or RSV, recently affect the health of their little ones.
It was rapid breathing, and it was her chest sinking in as she took a breath in and her stomach going out.
Watch out for any blue lips or struggle breathing, especially when they're sleeping.
Pediatric health systems nationwide are grappling with an uptick of respiratory illnesses. Close to home, it's the same story at Children's Hospital of the King's Daughters.
What are you all seeing at CHKD?
So we are seeing an increase. The big ticket items that we have not normally been seeing this volume is the RSV and the flu.
Director of Infection Prevention and Control at CHKD, Barbara Stein, tells me that at last check on Friday, 57 patients were in isolation. She says the record number is in the 60s.
I would not say that we're overwhelmed right this second, but we are much busier than we have been. We are still taking patients. We are not diverting, but we are very, very busy.
And Stein points out that while only some hit with the virus will need to go to the hospital, everyone can take preventive measures.
If they're in daycare, just be alert to know when to go to the hospital, which is if they're having trouble breathing. But other than that, I think our routine measures, potentially masking if you're worried, and again, hand washing, hand washing, hand washing.
Angelique Arentalk, 13 News Now.
Healthcare professionals urge flu shots for those 6 months and older. Tomorrow, there's a clinic at Greenbrier Mall in Chesapeake from 10 to 2. Health department staff will give out the vaccines at a drive-through clinic in the old Sears store. It's first come, first served. You do not need an appointment or insurance.